Welcome back to Mental Health America Seeds of Hope Empowering Moment. We hope you enjoyed our conversation with Boone County Prosecutor Todd Myers. And this week we're here talking to Lynette Clark, who's a Director and Managing Partner of InWell. Thank you, Lynette, for joining us.
Thank you for having me.
So, why don't you tell us a little bit more about InWell?
InWell is a mental health and addiction treatment provider. We serve Boone County, and we work with all ages, from really young children to geriatric, and all kinds of different mental health disorders, from ADHD to bipolar disorder, schizophrenia, and even addictions.
Great, great. Now, I have a couple questions for you. You and I both provide services here in Boone County. And we always hear about how bad our drug problems are, really nationwide, but here in Boone County. How severe do you think our drug issues are here in Boone County?
I do think they're very severe. There's a nationwide epidemic, and there's no reason to think that our community is any different than those types of levels. Daily, as I've worked on some situations with you, as well as other people in the community, we're getting daily folks in for treatment who are addicted. A lot of opiate misuse, but also other substance use disorders such as alcohol.
Okay. Well, as you're well aware of, there's a lot of people in our community that are trying to do something. It's hard to figure out what's going to work and what's not going to work. What do you think are the biggest barrier for both treatment providers and individuals that are looking for help with their drug problems?
So, for individuals that do not have insurance, it can be a barrier for treatment because it is very expensive. One thing that we try to help educate individuals about is the ability to seek insurance through a healthcare navigator to see what they may be eligible for, because at times we have found that that's been helpful for individuals to have coverage for necessary treatment. As far as an actual treatment gap, I think the biggest is medication-assisted treatment, medical and medical detox. Those would be the two areas that I think we lack in this community, which is a pretty substantial barrier for individuals getting into recovery.
Okay. And what do you think, if anything could be done better, either by treatment providers or the judicial system? Do you have any ideas as to what could be changed to help these individuals?
I think continuing the education piece is big. Individuals not recognizing that this is a disease, I think, provides a lot of difficulty in moving forward, as well as more collaboration that we can get within our community providers. I think the better it's going to be in working toward a solution.
And now, InWell has a program themselves that they run, I believe, 2 nights a week. Tell us a little bit about that.
So we have an extended outpatient program for adults that is running on Tuesdays and Thursday evenings, and our licensed clinical addiction counselor provides this program. It's a dual diagnosis program, and folks do have to be abstinent from substance use at that point. So in getting them there, we may utilize motivational interviewing techniques, as well as we do recently have a certified peer recovery specialist to help individuals get on the right path to recovery.
So really, listening to you, it tells me that there is a lot going on, and people can get help if they want help.
Yes, I believe that there is definitely a lot happening, still a lot more that needs to happen, but if somebody is looking to work on their recovery, I do believe that there are resources that can help steer them in the right direction.
And when people want to reach you, where can they call?
They can call our number 765-680-0071.
Great, great. And another thing, you, Mental Health America of Boone County and InWell are going to be collaborating some more this summer. We're going to be providing, as you know, we provide the base program, and then we provide a base summer program. And what will you be doing with that program?
So on any given week, we will have a different topic in which we will be working with all of the youth in that program. We will have the younger kids during one portion of the day, and then the older group of kids during another portion. So we will be providing some psychoeducation and some just coping skills that anybody can utilize, whether or not they have actually been diagnosed with a mental illness or addiction. Everyone can benefit from the types of information that we'll be providing. Those topics can range anywhere from positive friendships, healthy habits, to some education about substance use disorders.
That sounds great. I'm excited about it, and I can't wait. So, again, if you want to reach, if you have an addiction, get help, and the help is available. And if you want to reach InWell, the number again,
765-680-0071.
and don't be afraid to call. And even if you don't have a payment source, I know for a fact that InWell works really hard to try to get you some assistance, and that's where we'll start, is trying to figure out what we can do to get a payment source for you, and get you some help, and get you on a track for recovery. Well, thank you very much for joining us. Next week, we'll be talking to our Mental Health America's own program director, talk a little bit more about BASE and about what mental health does. Our first was with the prosecutor, and then InWell, and I think it's about time we tell you a little bit more about us. Thank you.